Hi, everyone. Thank you for joining our webinar. Apologies for the late start. We were waiting for people to join, but we will get started now. I'm Miriam Khan. I'm based in New York at Gradient, where I run communications and our partnerships. I will walk you through just a few housekeeping notes, and then I will hand it over to our moderator to get started. If you have any questions during the webinar, there's a Q&A function on your Zoom screen that you can use to ask the panelists and the host any questions. You might see that the webinar is being recorded. You'll receive a link to it after the webinar and also on our website at gradienthealthsystems.org or on our YouTube page of the same name. We always value any feedback or questions. So if you have any topics you'd like to see covered or have any questions following the webinar that you weren't able to ask, you can email us at customers@gradienthealth.org. And with that, I will turn it over to our moderator, Dr. Ndaba, who will get us started.
Thank you so much. Mariam, kindly confirm that I'm audible.
Yes, you are.
Thank you. Yeah, thank you so much. And greetings to everyone that has joined this very important discussion so far. Today, we are discussing a very important topic. I think most of us are familiar in one way or the other, or indeed we are experiencing it in our workplaces. So we are discussing burnout, wellness, and mental health among anesthesia providers. As you may be aware, burnout, wellness, and mental health have become critical issues in our practice due to the demanding nature of our work. I think this is something that we all recognize very well. So as anesthesia providers, our job usually involves working for long hours, making high-stakes decisions, sleep disruptions, and exposure to critical incidences, which we know would frequently cause emotional exhaustion, depression, anxiety, and ultimately burnout. So these challenges can actually affect, and they do affect, our well-being, professional performance, and ultimately patient safety as well. So this is a very, very important issue that we need to discuss as anesthetists wherever we are practicing. Therefore, this webinar will explore the causes, consequences, and recognition of burnout while highlighting some of the evidence-based strategies to promote resiliency, wellness, psychological safety, and a healthier healthcare workforce. So the scope of today's discussion, next slide, please. So our discussion today will be guided by the following headlines. So we'll define what burnout is and the associated terminology. We'll also try to look at the epidemiology, the statistics. I know there are several studies that have been done in different countries relating to this very important topic. We'll also review some of the risk factors for burnout, some of the mental health challenges or consequences and impact on patient safety and healthcare systems. Then we'll also discuss some of the measures or strategies that we can institute for us to be able to deal with the issue of burnout. We'll review some of the organizational interventions which in certain institutions they are implementing and others may yet to implement. And ultimately, we'll review some of the leadership, culture, and future interventions and recommendations that we can make just to improve our workplace performance. So to lead the discussion, I have two well-able presenters from Tanzania. These are practicing physician anesthetists from Kilimanjaro Christian Medical Center, the KCMC. So these two presenters have done some studies on the same topic. So I think they are well able to discuss this issue with us very well. So we have Dr. Happy Swai, who, like I mentioned earlier, is a physician anesthetist from KCMC, who will start the presentation, and then the presentation will be concluded by Dr. Alex Luisa, who is also a physician anesthetist from KCMC. And then let me also quickly recognize senior experienced colleagues on the call. Towards the end of the discussion or presentation, we really value your input on this very important subject. Without much ado, I'll allow our first presenter, Dr. Happy Swai, to take us through the first part of the presentation. My name is Dr. Ndava Spuka. I'll be your moderator from Soko Medical Center in Zambia. Thank you so much. Dr. Happy, you can pick it up. Thank you.
Thank you very much, Dr. Ndaba. As I have been introduced, my name is Happiness Swai, anesthesiologist working at KCMC Hospital. I'll take you through the first part of this topic, which is mainly the introductory part of the burnout. I'm sure each and every one of us have heard of burnout. And as people nowadays talk a lot about burnout, but there are a lot of misconception to what we really define as burnout. And people think burnout is when you feel a bit of overworked, tired, or stressed. However, burnout is a very special clinical syndrome. And WHO under ICD-11 and MASLACH have defined burnout as a syndrome resulting from chronic unmanaged workplace stress. And it has a couple of very particular symptoms. And the very first symptom is a sense of emotion exhaustion. And this is not just about being tired, the physical tiredness. However, it is a feeling of emotional drained energy or fatigue, like you cannot emotionally handle anything on your plate. And even if you have enough rest, let's say over the weekend or during the whole day, you still feel emotional drained and overloaded. And the second symptom is the sense of depersonalization or cynicism. And here you develop detachment or negative attitude towards people around you, and the people can be your client or your patient, can be your colleague. And it's like everything they say or they do, it irritates you easily, and you start treating them like objects. And you also you have a feeling like people have bad intention towards you. And the third symptom is a sense of reduced personal accomplishment or sense of personal ineffectiveness. This is low sense of efficacy or achievement. And in these symptoms, even if someone is doing the job very well, they still feel like it doesn't matter, or it's not giving them the same value as it was before. Next slide, please. Some statistics. So 40 to 67% of anesthesia providers experience symptoms of burnout, which is higher than the general physician, who have average of 45 to 50%. In 2020, USA data showed that 59% of the anesthesia providers have high risk of burnout, which has risen to 67% post-COVID, and approximately 14 to 19% have full burnout syndrome. And this is higher in residents, also in young anesthesia providers, also in the people that are working in the acute care setting. And overall, global variation is approximately 34 to 71%. And here we have two studies. That one was done by myself, and the other one was done by my colleague, Dr. Alex. In my study, it was a cross-section study that I was looking on the prevalence and the factors associated with burnout among resident doctors at tertiary teaching hospitals in Dar es Salaam, Tanzania. And a brief summary of my results, the overall burnout prevalence was found to be 33.7%, and the leading symptom was the emotion exhaustion, which was 51.5%. And the study that was done by my colleague, Dr. Alex, it was an analytical cross-sectional study. It was done to assess the burnout and its associated factors among healthcare workers working in the acute care setting at tertiary teaching hospital in Tanzania. And from his study, it was shown that there was high alarming prevalence of burnout among healthcare workers in the acute care setting of Muhimbili National Hospital, which was 62%. And the leading symptom was the the sense of emotion exhaustion, which was 90%. Next slide, please. So the risk factors, the anesthesia working environment risk factors. So the anesthesia working environment has a unique demand that increases the risk of developing burnout, such as high workload. So we have long working hours and frequent overtime, and also high patient volume and emergency cases, and also a high night shift on call duties with limited recovery time, but also high responsibilities. We work with critical ill patients, and with critical ill patients, there's need for continuous monitoring, but also we work with under complex technologies, the machine that we use, the monitoring modalities, all these put us on stress and are predisposing us to develop burnout. But also in a working environment, small errors can have serious or fatal consequences that also increase the stress. So all these are the environmental factors that are predisposing us as anesthesia providers to develop burnout. Next slide, please. So this picture is depicting a typical anesthesia department environment, which has high workload and high responsibility. As we can see here, it's around 4:32 a.m. and the ORs are still very active. And we can see Dr. Jenkins, who is an anesthesiologist, seated here, very tired, but cannot even take a rest because the ORs are still very active. He has to go back to work. Next slide, please. So what are the factors? So the personal factors that can predispose someone to develop burnout, perfectionism, personality trait. So if someone has this trait, especially when they are working in the environment which the systems are not working well, they are at high risk of developing burnout, but also high self-expectations, poor work-life balance. I believe Dr. Alex in the management is going to tell us how we are going to balance our work life. And also ineffective coping strategies, lack of sleep, and limited social support. These are factors that also increase high risk of developing burnout. But there are some groups that are at high risk, being young clinician, being a student, and also being a new consultant. Next slide, please. Some system organizational factors. So shortage of staff, which can lead to excessive workload, frequent on-call duties, inadequate staffing ratio. As for example, the recommendation or the standard in anesthesia practice, if you're working the OR, is to have two trained anesthesia providers. But most of our facilities, if you are very lucky, maybe working in the teaching hospitals, you'll find one trained anesthesia provider plus a student. But most of the facilities is just one anesthesia providers one anesthesia provider who is working alone or with assistant who is unskilled assistant. But also administrative burden. Some of us have also administrative roles. So you have to do the anesthesia part and also the administrative part. All these, they can predispose someone to develop burnout. But also lack of autonomy, poor leadership support, poor or weak advocates, lack of recognition at work, but also unsatisfactory salaries. Next slide. So there's some mental health impact of burnout. One, psychological consequences. So burnout is strongly associated with anxiety disorders, depression, emotion distress, and lack of sleep. And this can present as persistent fatigue, irritability, loss of motivation, and reduced concentration. Next slide, please. Another mental health impact is substance use. And so some people abuse substance or alcohol as a negative coping mechanism. And studies have shown that the anesthesia providers are at high risk of using the substance abuse, which also this put us more on the risk of developing burnout. And now when someone has burnout, they use again the substance as a coping mechanism. So it's like a vicious cycle. Next slide. And also another mental health impact is suicidal risk. And there are several studies that have suggested healthcare professionals and especially the anesthesia providers that they have increased risk of suicide. And this leads to, it also leads to results from untreated depression, professional isolation, chronic stress, and access to potential medication. And being an anesthesia provider, we all have access to the potential medication that can help us to do suicide. Next. So, impact of burnout on the patient safety. So, high risk of medication error, delayed decision making, and working environment, in anesthesia environment, we really need to have a quick decision making. We should be able to make quick decisions, but also burnout can lead to reduced vigilance, poor teamwork, and communication failures. All these will affect the patient safety. Next. So this picture is trying to summarize the scope of work of anesthesia provider. So as you can see, in the same day, anesthesia provider is required to be in the pre-anesthesia clinic and also in the operating theater, managing the anesthesia, but also working in the critical care setting, but also have to go to the PACU and to see the patient post-anesthesia, but also to do ward round and to do the pre-anesthesia assessment. So basically, we work everywhere in the hospital. So this environment is a real high risk factor for us to develop the burnout. Next slide, please. So the impact of the burnout on the anesthesia practice, we have seen. So it can lead to the medication error, equipment check omission, delayed recognition of patient duration, poor crisis management, reduced adherence to safety checklist. And all this will affect the patient safety. Next slide, please. So impact on the healthcare system. So increased absenteeism, staff turnover, workforce shortages. It also reduced productivity, high recruitment cost as there's high staff turnover, low patient satisfaction, and also can increase health care expenditures. Next slide, please. But there's also economic burden, like recruitment and training costs, as there's high turnover of staff. So new employees every time. So you need training and you need to recruit new employees, reducing operating room efficiency, increased sick leave, so people take EDs, litigation costs associated with errors, and also reduced quality indicators to the hospital. Next slide. So in general, burnout is the silent epidemic that can lead to depression, anxiety disorders, can predispose someone to drug abuse or substance abuse, also can lead to family conflict and also career dissatisfaction, and someone can decide to retire early. Next slide, please. So this diagram here is trying to summarize what I was talking about the risk factors of burnout to anesthesia providers. So we have all these risk factors like critical vigilance, high-stake decision making, case complexity, long working hours. All these can predispose the anesthesia provider to develop the symptom of emotion exhaustion. And from the emotion exhaustion, someone can go to the depersonalization, low personal accomplishment, and in the end, develop burnout. And as we have seen, the outcome of the burnout can lead to reduced quality of care, increased medication error, and someone can quit the job, and also there are a lot of mental impact to this anesthesia provider. And I think this marks the end of my part. I now welcome Dr. Alex Luisa to take us to the rest of the presentation.
So,
Dr. Luisa, welcome.
Thank you, Dr. Happy, for the nice introduction on the burnout topic. So I'll just take you through mostly how to manage the burnout now. So Dr. Happy has presented the problem, but I'll just be presenting the solution, like how to come up and manage the burnout. So to introduce myself, my name is Dr. Alex Luisa, anesthesiologist at Kilimanjaro Christian Medical Center. So just to start, so we have seen the problem. We have burnout, majority of us, that's what I can say, though we might have different levels of burnout, as Dr. Happy has presented. This is just mainly because of the workplace and the work environment which we are working at. So how to combat burnout and everything, now that's the next step, which I'll pass you through. So to start with, I'll just like everyone to understand the wellness concept. So what is wellness? So at most, wellness is just a dynamic process of maintaining physical, emotional, social, financial, and occupational, and spiritual well-being. So once all of these domains are well covered and then the well-being is there, then that's when the person will say like there is wellness. So not only one thing, but all the domains have to be covered. So at most, which Dr. Happiness has already covered, mostly of us we have combined over here mostly because of our occupational association. So we're exposed to this occupational hazard, which is burnout. Next slide, please. So professional burnout, as I said, and resilience. So escalating well-being challenges during the ongoing global crisis. So as Dr. Happiness has described, this is ongoing global crisis, which even in our low resource settings, we have seen a couple of studies which Dr. Happy has presented. The problem is also there. So the high level also, which has been highlighted, especially on anesthesiologist, which the studies done by myself and Dr. Happy has shown the burden to be significantly high, especially on our cadre. So what do we need? So developing emotional intelligence among anesthesiologists is crucial for enhancing resilience and improving patient care outcomes, as we've seen that burnout can even affect the patient outcomes. So the World Federation Society of Anesthesiologists, WFSA, currently, even last year, the theme was about well-being and wellness, is actively promoting training initiatives to address the burnout challenges. So as it is recognized, Dr. Happy also has pointed out anesthesiologists are mostly affected, but also should be the key leaders in pursuit of safe surgical care globally. Next slide, please. So how can we build this resilience? So we need positive coping mechanism, emotional intelligence, and then healthy relationships. This not only at work, but also socially, self-awareness, continuous learning, like what you are doing at the moment, and then also seeking support early. So you might think you are healthy, or as Dr. Happy initially has said, like you hate other people, you treat people like objects. That's one of the symptoms. So if you find yourself you have burnout, no matter what level, so you should just start seeking support early. Even if you think you have burnout, start seeking support early. Next slide, please. So what are the individual prevention strategies which we can adapt? So most of the studies have shown multiple factors which are making people be prone to burnout. So when coming to our profession as anesthesia providers, so adequate sleep is needed to prevent burnout. Regular exercise has been shown to have reduced the chance of burnout. Healthy nutrition, what are we eating? So mostly we are working in a very stressful environment. Sometimes we even skip meals, or sometimes we just go for those quick meals which are not healthy. So we should also check our nutrition. Mindfulness, you'll see later there's a nice diagram which shows this. Stress management, how are we handling our stress? So the environment can be stressful at work and at home. So how do we manage it? Annual leave, though sometimes it's quite difficult, especially in our low resource settings when you're trying to seek to get more money, and then some people even don't take their leaves, but leaves are there, just important so that they can help you recuperate. Time management, peer support, professional counseling when needed. They've also been indicated as individual prevention strategies to reduce burnout. Next slide, please. So this is the official newsletter which shows reduced burnout, which lead to improved safety and efficiency. So they've proposed this pro-social behavior. So what is pro-sociality? It's any behavior which is oriented toward the welfare of others or one group as a whole. So you can see this nice image down here. As I said, the wellness, how can you do it? The like yoga sessions. So trying to schedule for a yoga session, but the time which has been pointed out for yoga, this person here is saying that I have a consultation word round at that moment. So what to do? No, 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 thank you. So let's not skip some of the social events which can help us in this wellness or to reduce the burnout. Next slide, please. So we have seen the individual part. How can the organization help to prevent the burnout? So most this may not be within our hands, as I can say we are at the bottom of the food chain or the normal stuff, but the leaders, or once we become leaders, what to do so that we can support the whole organization. So one thing most important, maintain safe staffing, reduce excessive workload, as we've seen that excessive work and working hours, and then promote psychological safety culture within the work place. Encourage teamwork so that also the workload can be shared or reduced significantly to most people. Provide wellness programs what are you offering for social activities or wellness of the department? Offer confidential mental health services. So when I encourage people to seek support early, so make sure the support is confidential rather than going to disclose your problems or challenges and then later you find the whole corridor is discussing your problem, then not a lot of people will be confident to go forward next time. So also recognize staff achievement. This is more like appraisal, like praise those who are performing and even small things just for encouragement. Improve leadership support. So whoever is leading, so make sure as the organization, as a leader, you'll see later what's a part of the leader in this wellness. So if the support is there, then the whole staff or the whole organization can move forward in the wellness programs. Next slide, please. So prevention among anesthesiologists or anesthesia providers. So mostly, as I said, at the individual and then also organization. So first, what most of the studies have pointed out, particularly this one, if we promote positive work environment, which can be done by fostering robust metrics and team dynamics. So as I said, if we more like encourage teamwork so that the workload can be shared, emphasize social support and, and resilience building so that the workplace culture, it's more of wellness and well-being, emphasizing. Intervention to combat burnout should target individual resilience, organizational changes, and enhanced teamwork. So nothing should be left behind if we are to combat burnout. Next slide, please. Next slide, please. Okay, thank you. So this is a nice diagram which I was saying, which can be achieved at the level of the department or organization. So how many of us in our areas, we have a place like this? This can be a lounge in your operating theater or intensive care unit, or even just a large lounge which can cater for whole hospital staff. So you have the relaxation zone, quiet pods. Some of the people, like some of us, don't like to interact with people. So in our cooling period, we just prefer to be quiet. And then also team wellness is our priority. You can just also be talking and sharing. What challenges do you have at that moment? You might find a lot of your colleagues also are having the same challenges. And then how are they coping with them? So you can just be sharing your ideas and then find a solution to your challenges. Next slide, please. So we've seen the organizational, but now with the focus to our professional as anesthesia providers. So as anesthesia departments, what can we do? As Dr. Happiness has pointed out, anesthesia providers, we are at a higher risk. This is mainly because of work environment and the stress of the patients who we have to cater or we have to care for. So a lot of our patients are critical. So what happens during those cases? The outcome might be bad. So how do we debrief? How do we manage after the bad outcome? So we can have critical incidents debriefings, mentorship programs, especially as Dr. Happy has pointed out that mostly the young anesthesia provider who are at a higher risk. So also not to forget residents, so resident wellness committees, so that also they can propose ways, fatigue management policies. So this, if I understand most or majority of the places we have shortage of staff. So you might find fewer staff exposed to a lot of work, so they'll be fatigued at the end of the day. So how do we manage that? So this can be made from the organization or within the department to organize how, if you see the person has worked a lot, how to help them. So flexible scheduling, protected teaching time. So this especially for our trainees, and then wellness champions. So who is a leader? Who is proposing ideas? Who is there to always check how other people are doing and encourage them? You can choose a person to be a wellness champion so that everyone can be like, that's not laziness, rather than that's wellness or well-being. Next slide, please. So this, as I said, in our departments, we can challenge ourselves to develop a wellness program or wellness culture. So on the left side, you can see on the left side column, the system domains. Those are the things which you can adjust, like a specific scheduling, documentation, support system. And then the middle column, that's like what is there at the moment in most places, and the optimization or proposed or prevention strategies. So you can see, for example, documentation. So we know we have to induce, maintain, and emerge a lot of cases in a single day. And then also we have to document. So a lot of things can be happening in one case. So how can we counteract that? So propose, like here, optimize prevention strategies. We can have AI powered scribble systems and chatting templates. Rather than for you to be chatting on a piece of paper, that work can also be minimized within the department by electronic medical records, which electronically it just chats by itself. Or the infrastructure now is the picture which I've shown you. We need those launch or areas or wellness corners where you're on call, it's less busy. Do you have a place to rest? So, or you're just free, you've got your 5 minutes, where can you go? So within the department also, there should be those areas where a person can just be acoustically isolated on call or on duty, decompression suits. So this can be done or can be planned within a year, which can be starting with auditing and then reform by putting all these strategies. And then the support, which will deploy the trained or peer counseling, and then also to be reviewed as any program or any quality improvement project, you need monitoring and evaluation at the end so that you know if it's working or not. Next slide, please. So recommendations, how can we achieve that wellness? So routine burnout screening is, we know it's a problem, but also we should know what's a burden. And if now from this presentation, I expect a lot of us now, we are aware. So some of us might start employing the wellness strategies. So how can we do it? So at the end of the day, we need the screening. So what's the level of burnout at our center, for example, and then how are we aiming to reduce it? And then so that we can just be evaluating it routinely by screening. So supportive leadership, as I said, and then you'll see on this later. Safe work, our policies, as also explained, mental health resources, team-based wellness initiatives, organizational accountability. Next slide, please. So on the next slide, we will see how these things are helping on this column of rationale. So with adequate staffing and workload management, so as we have seen, excessive workload is one of the strongest predictors of burnout. So if we have appropriate staffing, manageable caseloads, protected rest periods, these have been shown to reduce burnout. But on a greater thing, or what we need to do or aim at, is to improve patient safety, but also our safety. So coming to number 5, which is debriefing after critical incidents, which I understand most of us, we face these cases. So we should have some sort of structured peer support after adverse events, which will help clinicians to process emotional stress, reduce isolation, and address the second victim phenomenon. So yes, our cases are bad. So sometimes you might be fatigued just because of the cases which you do, but how are we coping with that? So the debriefing has been shown to be helping a lot. Next slide, please. So I said a lot, but we need leaders. So as we know, every area, every department has a leader. So leadership, culture, and future directions. So as we have seen, burnout prevention is not solely an individual responsibility. We have seen the department or organizational roles or strategies. So definitely at the end of the day, if it is that multifactorial, it requires effective leadership, organizational commitment, I've seen somebody on the chat asking if there is any representative from the Minister of Health from Zambia. So that's another nice call. So also the organization, not only at the hospital level, rather than at the national level, and the culture that values clinician well-being. So this within the society also can be emphasized. So personal resilience and self-care are very important, as we have seen, and sustainable improvement in well-being require organizational commitment and effective leadership. Next slide, please. So as I say, I think you've skipped the slide, the previous one. Okay. So as I said, every place has a leader. So leadership is one of the strongest organizational determinants of physician well-being. I believe if there is a nice leadership at any place, even that workload will be shared, first of all, and even the burnout burden also will be shared. And once the leader is affected, that's when you find the solutions at most places. So leaders can influence workload, staffing, communication, recognition, psychological safety, and access to support services. So there are multiple roles of a leader, but focus on the burnout. So the leader can model healthy work-life integration, or foster open communication, recognize and appreciate staff contributions in the department, ensure fair scheduling and equitable workload distribution, encourage help seeking without fear or judgment, allocate resources for wellness initiatives within the organization, also to monitor the staff well-being through regular feedback. So yes, our leaders are entangled in a lot of other administrative activities, but this now comes like an alert now for them to look into these aspects of other roles of the leader in the promoting well-being. Next slide, please. So, as I said, our culture or our workplaces, we have that culture of blame. So how can we move to a just culture where system failures are addressed while maintaining individual accountability? So that's why I focused most, I was emphasizing most on that incident reporting, because if we see in a lot of places, that's what usually happens. We focus mostly on the blame or what went wrong, who did wrong. So a healthy workplace culture should promote respect and civility, teamwork, inclusion, psychological safety, and also learning from mistake rather than assigning blame. So if something bad has happened, it's one thing to acknowledge it, but what are the learning lessons from that mistake or from that critical incident, rather than what somebody did wrong or did not do. That should be the focus. So that's the just culture. Next slide, please. So as I said, whenever we want to intervene with our wellness or well-being programs, so we need to monitor and evaluate. So how can we monitor? That means with routine burnout measurement. So common measurement tools for burnout, this include Maslach burnout inventory, Copenhagen burnout inventory, and Stanford Professional Fulfillment Index. You'll see later this, they've been compared where the Maslach has been used a lot in studies, and it's the oldest, which covers a lot of professions. So even the health medical personnel, also there is a specific tool which can assess burnout just on their field, on that profession. So organizations now should routinely measure burnout, job certification, psychological safety, staff engagement, workforce retention, sick leave, and turnover. So you might find a place, a lot of people are leaving that place, so that's one indicator that there's something wrong. People might not say, or some people might just stay because of the money which they're getting. But if you ask them, are they satisfied with their work, you might get different answers. Next slide, please. So as I said, these are the three tools which you have seen over there. So the gold standard is a Maslach burnout, which is widely used. The Stanford Professional Index Fulfillment. So this is the newer tool with fewer long-term comparison studies than MASLASH. But this covers the professional fulfillment, work exhaustion, and interpersonal disengagement. These are the domains which are measured. And if you look at the strength, measures positive aspects of work as well as burnout. So it's validated in healthcare profession. While if you look at the MASLASH, which is the commonly used, allows comparison across studies because it can also allow comparison across studies, but mostly it's just focused on the burnout. So if I'm to recommend, I would recommend if we can when we are implementing this well-being or wellness programs in our areas, we can focus mostly on the Stanford Professional Fulfillment Index, which from this here you can see it has a lot of strength with when compared to the other tools. Next slide, please. So as I said, the organization, yes, department, yes, individual, yes, but we need to cover this at a larger scale. So national and international wellness initiative also should be advocated. So as well-being has become a global healthcare priority, as WFSA also has done it, so professional organizations and health agencies worldwide have developed policies, guidelines, and programs which address clinicians' burnout. So mostly they just want to promote evidence-based interventions, as you've seen on that nice table over there, which the intervention which can be done and then the rationale. So mostly they just want to advocate for the healthy workplaces, support institutions in integrating well-being into healthcare delivery and professional practice. So the main aim over here is for the safety of the healthcare provider, but also the safety of the patient who we care for. Next slide, please. So integrating well-being into anesthesia training. So majority of us, this is our first time hearing about burnout. It's not a bad thing. It's a good thing. At least now we are aware. But this should have been incorporated very early within our training and continuing professional development, as we are doing at the moment. So the training should include stress management, resilience as covered, fatigue mitigation, communication skill, leadership, peer support, and mental health awareness. So when we embed wellness into education, this prepares clinicians for sustainable, healthy careers. So you've seen Dr. Happy has presented how anesthesia providers or burnout healthcare providers have higher risk of suicide ideation, suicide committing, and also substance abuse. So if you want a healthy career, definitely you will not achieve if you are burned out. So this is a shared responsibility where we have to employ sustainable well-being programs which require resilient individuals, supportive systems, compassionate leaders, and healthcare systems that prioritize the health of those who care for others. So as I said in multiple times, the main aim is also for the patient and ourselves. Next slide, please. So from burnout prevention to thriving workplaces. So we have seen Dr. Happy presented on the burnout, and I presented most on the well-being, so how to prevent the burnout. So how can we achieve that? So you can integrate all of this from the individual level, team level, organization, and then also the system at the national level. So the future of anesthesia depends not only on developing excellent clinicians, as I said earlier, but creating workplaces where they can thrive career-wise and also socially. So multiple levels should be checked and supported. So from the individual as presented, resilience, it's very important, and self-care and mental health support. So at organization level, we need compassionate leadership, adequate staffing, fair workload, wellness policies, and supportive workplace culture. So coming at the most important thing where majority of us lack, it's the national level. So the health system, how can it help us? So from the national wellness strategies, I'm not sure in the sub-Saharan countries if there is any strategies which have been or policies which have been incorporated. When I was doing my study around 2023, nothing was there as burnout within the Ministry of Health in Tanzania. So professional standards, this is something which you are working on mostly. So research and innovation, especially on the well-being, but also sustainable workforce planning. So yes, we have shortage, but how can or what can we do to improve the workforce at the moment? If you look at that WFSA workforce map, you can see the area, mostly the sub-Saharan, is in red. So that's a shortage which we have. That's a risk to burnout amongst ourselves. So how are we planning to improve that? Next slide, please. So coming to an end to this presentation is we have seen burnout is preventable by the strategies which I have proposed, but also Dr. Happy and myself have talked a lot that how it can interfere or can threaten the patient safety, which is our primary goal at the end of the day. So healthcare system should bear significant financial and workforce healthcare system bear significant financial and workforce consequences. So individual resilience alone is insufficient if the system, the organization, or the department, the team is not helping. So organizational changes or system changes, it's very essential. From the national level, the WFSA has helped us. So how are we going to employ that or deploy that within our national societies of anesthesia providers? Also to the national, in terms of the Ministry of Health, because not only anesthesia providers are affected, but we are working as a team in our theaters. We have our scrub nurses, we have our surgeons. I'm sure they're also burned out. So healthy anesthesia professionals provide safer patient care. I don't think if I need to explain this or emphasize on this, we are all aware of this. So we need to be healthy, we need to stay healthy. How can we do that? We need to work ourselves to have that individual resilience, to have teams which support us, to have organization which also support us in our well-being. So coming to an end of our presentation, I'd like to thank you all for listening. The next slide is just on the references. Thank you. Oh.
Thank you so much, Dr. Louisa and Dr. Happiness, for the wonderful presentation. I think this was a very, very important topic. As I can see comments in the chat, I think I totally agree with everyone. Very important discussion indeed, because this affects all of us as a profession, and we really need to make sure that we prioritize our mental health above everything else. So thank you so much once again to the two presenters for making this easy for us to appreciate. So we've come to another very important segment where we invite questions or clarifications or even indeed contributions. Please feel free to raise your hand, unmute your microphone, and then go ahead and make your contribution. While waiting for any comments to come through, let me just quickly recognize some of our senior colleagues who've joined this important discussion. We have Dr. Mumbwe Mbangu, who is senior and experienced anesthesiologist from Zambia, who also did some study on the same topic. And I think I'll be glad to invite him to give us some comments. I'll also recognize Dr. Ridit, Dr. Shweka from Kenya, as well as Dr. Abdullahi from Nigeria, and so many other senior colleagues that are present on the platform. Let me invite Dr. Christian Bagayamukwe. I think the hand has been up for some time. Do you have any comments? Or do you have any questions? Okay. Okay, let's move on. Please feel free whenever you are able to talk, Dr. Bagayamukwe, and speak to us. But I'll invite Dr. David Oyite. Please go ahead and make your contribution.
Thank you very much. I am very grateful for this presentation. David Oyite, as being told to you. I am an anesthesia provider from Uganda. I work in a hospital called Busolwe General Hospital. I want to thank to the two colleagues that has given us elaborate explanation of the burnout. Burnout is real, and when we hear, we may not know the impact, but when it is backed up by studies from around the world, that is when we will agree that it is real. It is not only an anesthesia provider, as Dr. Appiah said, the whole team, you find that there's burnout. I was looking at the bit of what really brings this. There's a study that I'm doing currently on the workload. How does it impact on our daily life as professional? I did it in anesthesia. And you find the results is alarming. How do the all hospital have one anesthesia provider, as Dr. Appiah has told us? We need to have a lot of help from other organizations, more especially our government should look into this. How do we deal with the workload? Because at the end of the day, we shall all agree that the burnout is coming out of the workload. You can't employ one anesthesia provider to run the whole general hospital. This is a big concern, and virus government should take an initiative. My study was a mixed method study. I get the perspective of the leaders at the district, and they told me that there's a lot of bureaucracy when you go to recruitment. An example in our country, you will find that the fund is there, but you first have to ask government to allow you to recruit, yet they've already given the fund for recruitment. If they don't clear, you don't go on to recruit. So as I end my submission, this was a really, really, really needed presentation to us, the anesthesia provider. Thank you. I submit.
Thank you very much, David, for that very important contribution. I think that adds very well to our presentation. Thank you so much also for sharing what you are doing in terms of your study. Please share with us your findings as well, so that the more informed we are, I think the stronger the influence and the stronger the advocacy for our profession. So thank you so much, David, for that valuable contribution. I will invite Dr. Mbangu Mumbwe also just to quickly chip in and give his perspective of this discussion.
Thank you so much, Dr. Spoka. And to the presenters, Dr. Happiness, Dr. Luisa, thank you so much for that brilliant overview. I think we need to have more of such discussions. Mine is just to highlight a few issues that pertain to LMICs in the context of burnout. And as Dr. Spoka generously hinted, I had the privilege of doing a study myself between 2017 and 2018, looking at burnout among anesthetists in Zambia. The thing is, the constitution, or should I say the makeup of the anesthetists in our country is a mixed pool of physicians and non-physicians. And so we looked at it collectively and assessed the prevalence of burnout. Now, part of the problem and the challenge we face in the addressing of burnout as LMICs stems from the bottlenecks that confront us. You see, the first one, and which I would like to highlight, is on the research gap. You will notice that most of the studies on burnout out there, very few actually pertain to LMICs. And so we have very few studies that actually look at our individual characteristics and challenges in sub-Saharan Africa. Visibility an issue, and we also see that the type of study designs that our studies adopt, which is the cross
Hello, Dr.
driving
Mo.
burnout.
Oh, okay. We lost you for a bit. Can you hear us? Hello, Dr.
So
Mumbwe.
from a point, oh yes, can you hear me?
Yes, we can hear you now. Thank you.
Okay.
I think we seem to have lost Dr. Mumbwe completely. I think when he joins back, we'll allow him to complete his comment. So we have another hand. Dr. Mumbwe, are you back? Okay, so yeah, on the platform, I'm also joined by I'll call them my panelist colleagues. We have Dr. Papicho and Dr. Sweetbet Ansbet from Tanzania and Zambia, respectively. So please, at your own time, feel free to just chip in and make your comments. As we wind up, I think probably in the next 5 to 7 minutes, let me just read through some of the messages in our chat box. There is a question from Sistone. Sistone wanted to find out if the chief anesthesia from Ministry of Health Zambia was represented on the platform. Not quite sure on that. Yeah, David Mumba says this topic is awesome. Please let this be done more often. Yeah, I agree. I agree with you on that. Juliet says thanks for the topic. I thought it was only in Uganda. Yeah, so burnout is everywhere. So let me just review other contributions or comments from the Q&A. There's a question from Anonymous here that what strategies have you implemented at KCMC to determine the magnitude and prevention of burnout? How effective are they? So I'll allow either Alex or Happy to just elaborate on this question.
Thank you, Dr. Ndaba.
Yeah.
So just to be brief on that question, it's a good question. Like me and Dr. Happy, we've done the research on that. So I think we are the right people now to be asked that question. So at KSMC, first of all, we had baseline data, the burnout. But although it was mixed population because it was among anesthesia providers and emergency physicians and critical care providers. So the burnout was around 59% at that time, which was around 2017. So in the meantime, what have we done? So as I was emphasizing, it all started at the organization level. So first, I can say we have a good leader at the moment, who is Dr. Happiness. So within her leadership, we have been able to start mentorship programs where the junior from the specialist, junior residents, they're all mentored thoroughly. So we have this connection also with other hospitals which are outside of Tanzania, in the US, in the UK. We can also assign one person to be mentored from that other place. So there's local mentorship and also there's international mentorship. And then also socially now we have started this yearly department outing. For the last year, 2025, we had a 4 days outing trip, which for those from Tanzania, I'm sure they know Magoroto Forest, which is in Lushoto. That's where it was done. We went there. And for this year in 2026, we are planning a trip. It might be to Zanzibar or to Ngorongoro. So welcome to KSMC, all of you. And then also the allocations now. Yes, I can say we have shortage of staff, but we are trying our best, our level best, to make sure that those people who are working in those long theaters which have long lists, they don't stay there, let's say, for the whole week or more than a month. So they can be rotated so that we share the work burden rather than having a person who is always in the theater, which, let's say, starts early and then finish late every day. But also in terms of the just culture, we have shifted from the blame culture. So we do regular M&Ms or critical incident reporting. So where the critical incidents are reported, and we have made this culture, it's very open. We don't blame anyone. It's mostly for academics, since this is also academic institution. So no one is blamed for what happened, rather than we find that opportunity to be a learning opportunity so that we can share the experience, which will be helpful also for the next patients. Thank you. So, but just to add up, but we are on the process now on evaluating what have we achieved after all these strategies. So that one we have not done yet, but we're on the process of doing. Thank you.
Yeah, thank you so much, Dr. Alex, for that response. It covered quite a handful of points. Let me once again invite Dr. Mumbwe Mbangu to come back and complete his comment.
Thank you, Dr. Spoka. I was just talking about the research bottlenecks, and I mentioned that one of the challenges in sub-Saharan Africa we face, and which draws us back from a policy perspective, is even the diagnosis of burnout is usually not very uniform, because if you examine the studies that are out there using the same tool, the criteria of how to score and come up with the diagnosis of burnout has been shown to be quite variable, which makes it difficult to compare from setting to setting. However, the truth is, what has already been highlighted by the presenters, the shift is about engaging both emotional resilience of the sufferer, as well as implementing structural and leadership reforms that favor addressing burnout. And then paying particular attention to the context of sub-Saharan Africa, like in our case, where we have non-physicians and physicians, we need to look at the factors that are affecting each individual group, rather than look at them as a blanket entity. So, I mean, there are some non-physicians, for instance, who are working in rural settings where they're the only anesthetists covering and they're doing 24 to 72-hour calls continuously. They are isolated. They are faced with drug shortages, oxygen shortages, and working with very dysfunctional and outdated machines. For such people, things like resilience, emotional resilience, and wellness retreats, mindfulness, which are important, they might not be very beneficial unless we address the structural problem that we are faced with here, which means we need to improve on the training and recruitment and ensure that the policies take into consideration equitable distribution of officers, even to these rural settings. And in the spirit of improving teamwork, it might be necessary that the policymakers also look at formulating scope of practice, because one of the other issues is that people sometimes do not know exactly what is expected of them and how much they are supposed to shoulder before they refer or maybe engage extra help. And so scope of practice that clearly entails what physicians, non-physicians might have to do, and clearly defines how to cope with that workload might go a long way towards improving teamwork. The other thing I wanted to talk about was on the administrative bottleneck. One of the other issues that affects this parameter is the fact that career progression opportunities are sometimes a big issue. You find that mentorship, fellowship opportunities are not uniformly equal, and this might go a long way towards diminishing morale. You find promotions lag behind. People mentioned, the presenters already talked about little recognition. All these things might lead to brain drain, which then causes a vicious cycle of the burnout problem, because we know that we're going to have fewer mentors and there'll be even a bigger workload for those remaining behind. Then the last thing I wanted to comment on was on the cultural aspect. In LMICs, this is also being recognized as an issue, because we have hierarchies which are designed to facilitate smooth workflow between specialties. And then sometimes we find that the negative or the drawback effect of this is that hierarchies sometimes make it difficult for junior officers to speak up and maybe get an impartial, or should I say a fair amount of or should I say impartial kind of approach towards conflict resolution. And so they might feel marginalized because the hierarchy does not favor that they speak up and air their concerns and problems. So these things need to be looked at, especially when we talk about leadership in LMICs. Thank you. I just thought I highlight some of those issues. Thank you so much.
Yeah, thank you so much. Great contribution, Dr. Mbangu. We are thankful for that breakdown of issues relating to the LMIC. So thank you so much for that valuable contribution. We really appreciate. As Siston in the chat box also comments that I love the analysis from the Zambian setup. That is why I asked the first question on the Ministry of Health representation, because the biggest problem in Zambia is related to the system. Esther Shirima says, thank you so much for the wonderful session. It was thoughtful, insightful, and really resonated with me. I appreciate how you approached such an important topic with both honesty and care. Thanks again for sharing your time and expertise. Thank you, Esther. We are grateful. I think in the interest of time, I would have allowed the panelists also to share their insights. That is Dr. Papicho and Dr. Sweetpet. But let me maybe allow Susan Julian, who had her hand raised for some time now, to make a contribution before we wind up in a moment. Yeah, so Susan, kindly unmute your microphone and make your contribution. Your mic is still muted, Susan, so we can't hear you.
I have unmuted it.
Okay, yeah, we can hear you now.
Yes, I'm working from Benedictine Eye Hospital in Tororo. I want to thank you very much for the presentation. It has helped us so much. I want to highlight some few things which causes a lot of emotional exhaustion and burnout, which sometimes you find yourself, you are the only one to make suggestion, you are the only one to make evaluation of a patient, and sometimes you find patients when when you refer them, they don't want to go where you have referred them. So you find that you are in dilemma in between, and the patient is serious and you make your own decision. But after making a decision, maybe you get some challenges on the patient, and then that after doing the patient, maybe the patient has got complication, you get exhausted about a patient you have waited for a long time, then you sometimes you get some blame as if you are the only one as if you have taken the patient with one your force. So sometimes those are challenges which we get, but at least on this presentation, it has helped me a lot. That's my contribution, which I get. Thank you very much.
Yeah, thank you so much, Susan. We are grateful for that contribution as well. Thank you. So at this juncture, I recognize we still have quite a number of comments and questions in the chat box, but I think in the interest of time, we will take note of these questions and try to respond via email addresses as well as other platform. Otherwise, thank you so much for the questions. Maybe let me just allow, I think this one is very important. Either Dr. Alex or Dr. Happiness. There's one question here which says, if those burnouts are not treated, can they result in total psychiatric disorder? I think this is an interesting, can somebody develop a psychiatric illness as a result of untreated burnout and work-related stress? Anybody, either Dr. Luisa or Dr. Happy?
Thank you, Dr. Ndaba. So when we're reviewing the literature, burnout itself has been also in some places cited as more like a psychological problem, like a disorder. Even in ICD-10, it's linked to that. So can it also develop other psychological or psychiatric problems? Yes, I can say, because there are studies which have associated higher levels of burnout, which can lead to major depressions in later, or the substance abuse, which has been caused by higher levels of burnout, which also can later unmask other psychiatric problems in an individual. So yes, though most of the studies which I have reviewed, it's not directly. So most is just associated with the coping mechanism which that person will employ to manage that burnout which the person has. Although burnout itself has been shown to be associated with having higher levels of depression. Thank you.
Thank you. Thank you so much. What a wonderful way to close the meeting. So thank you so much to the two presenters, Dr. Happy and Dr. Alex, for taking your time to discuss this very important topic with us. Thank you so much for everyone that joined the platform and also made their contribution. Thank you to the panelists as well for making this possible. At this point, I would like to invite Magdalena from Gradient to give us some closing remarks. Thank you so much.
Thank you very much for our presenters, Dr. Happy and Dr. Alex. Thank you so much for sharing your research papers with the whole globe. The insights were amazing. Good to know that everybody is sharing into this, and many have received a lot of your knowledge, and are going to be applying some of these things that you're also applying at KCMC. And we look forward to having more of this discussion. So please watch out for more webinars as they come in. Just good news that these webinars are going to now start coming in through our Gradient Institute. So we are moving these discussions to Gradient Institute, still under Gradient Health Systems, but now under Gradient Institute. Thank you so much. And please also visit our website, Gradient Health, to look into our machines. That's the UAM, the ICV, the Prima, and what they offer, and also for our product webinars also that will be coming along. Thank you so much, and yeah, watch out also for the recording for those who would like to go back to the presentation. Thank you. Yeah, bye-bye.
Thank you. Bye-bye.